We've had a great conversation up to now, but of course it all steers back, as it were, to you guys with your MP bit, but you're eminently qualified because you're also a doctor. Despite all of the extra money, there still isn't the capacity. What are we doing wrong?
So one of the problems I would suggest with the way the NHS has been managed is that we like to run the system hot all the time. So within 95% bed capacity, so that we always aim to have 95% of beds filled, and we don't always have the additional capacity available, as you just heard from Professor Secura, in terms of diagnostics, particularly CT scans, MRI scans, and the like. And that's an important area to invest in. My two thoughts, though, I would say, is that I agree with what's just been said about the ability to build some short-term additional capacity in the NHS by better using the private sector, and also providing the ability for patients to continue to have scans or operations into the evening or at weekends in the short term. One of the big problems, though, we also have is there's a disincentive at the moment for senior clinical staff to work extra hours in the NHS because of the pension structure and the fact that many senior staff are penalised financially for doing extra hours because of the way that the pensions work and the way that works with the annual allowance. So if I was going to suggest one thing to ministers to help encourage staff to put in even more hours into the NHS, that would be to deal with this pensions problem, because that's a key issue in terms of building short-term extra capacity. In terms of the longer-term issues, it's vital that we invest more and we train more staff. That's something that I'm afraid it requires long-term thinking rather than the short-term thinking of the political election cycle. And we also need to deliver much more integrated services with social care as well.
Absolutely. The point about the pensions I'd forgotten about, but I remember when it broke as a story, reflecting upon it, and that's a dead easy change to make. And just get the Sajiv to sit down and talk to Trees Coffee, and that could happen. The other thing that strikes me with you mentioning there, we like to run it hot, and we need to look at short-term capacity that may be available in the private sector. Chris Hopson from NHS Providers made the same point. He also talked about joint working between hospitals and people maybe being ferried from one part of the country to another, not too far, because there was a wee bit of capacity there. And Valence Owen, formerly of Bupa, also said, we need to milk the private sector. These are all great ideas. What I don't understand is if we're facing the prospect of as much as 13 million people on this waiting list, why isn't all of that happening right now?
Well, it should be, and I understand certainly that NHS England are engaging in conversations with private providers. We did it very well during the COVID pandemic, so there's no reason, during the peak of the pandemic, should I say, there's no reason why that shouldn't now continue when we're catching up with the backlog in terms of cancer care, elective operations for knees and hips and orthopaedics and all the other areas where we have increasing waiting lists. And that's something that, in fact, consecutive governments in the past, and Tony Blair, when he was Prime Minister, used the capacity of the private sector very effectively to cut down waiting lists.
Dan, let me interrupt just to ask a specific question, because that's music to my ears. But who needs to do that nudge? Is it Sajiv at the head of the department, or is it the boss of NHS, or as Richard Vultry implied, maybe it's the directors of hospitals and GPs themselves? Just get on and do it.
I mean, the primary responsibility for this at the moment would sit with the head of NHS England, and I know that's something they're looking at. But of course, there's always a political outcry when you talk about using capacity in the private sector. But in the context of what we're facing now, with people potentially facing worse outcomes and even death because there is this backlog of care, I think we've got to just put aside these philosophical issues and pragmatically look at that capacity. And I'm sure that's something that we will see much more of in the months ahead. The other point on this, though, as well, is that the NHS could deliver more capacity with weekend lists for operations, with more diagnostic tests being done at weekends and out of normal hours. But again, that comes back to that pensions issue that we just discussed, because if staff are going to effectively be penalised for working extra hours because of the pensions penalties, they're not going to do it. So that would be my number one request to Sajid Javid and indeed to the Treasury. Let's get this pensions problem sorted out.
point taken, and I hope heard. The final question, and it's almost a personal one. Chris Hobson at the very beginning said, yeah, we've got to sort out this waiting list. We have a moral imperative to do it. Do you ever look around your place of work and the people that you're working with and the people that you are trying to heal and become depressed, despondent, that it's looking as if it's almost too big a problem?
Not really. I mean, what all you do as a doctor is you treat the patients that you care for every day, and you do your best to improve the human condition. You can't make everybody better. There are things in the system that frustrate you. I do my best to take those frustrations back to the House of Commons and raise those issues in debate. But the main priority of a working doctor is to do your very best for your patients. Some get better, some don't. Some make partial recoveries, but that's what medicine is about, and that's what very much makes me tick as a doctor. That's what I think most people are in healthcare for, because we want to do our very best for our patients.
Great to see you, Dan. Thank you very much indeed for your time this Sunday afternoon. Hope you enjoy the rest of your day. Thank you. That's Dr. Dan Poulter there, Conservative Member of Parliament for Central Suffolk and North Ipswich, but also a hospital doctor who just gets in there and does his best. And how lucky the folk there are that he does.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.